Hi guys, it's Kathy. I hope that you're having a good day. We made it through Saturday. I was screaming a lot last night. Fuzzy. Someone needs to disable his create account button. You're not late at all. We just started. Yeah, yeah. This is a fact. This is a proof. In mathematics, this is a proof right here. Hi, Betty. Hi, USA. Beck, CJ, Bren. We have Australia is covered in chat. Don't worry. Hi, Sharon, Callie, Hope, Fozzie, Michael, Lori. I just want to make sure I didn't miss anybody. I'm scrolling up. Donald. Oh, look, Donald. Donald just typed everybody out. Got it. Got it. Becky, Betty, Rebecca, CJ, Kelly, Bren. Hey, I'm good. Today, I just want to hammer home the point that if you're going to commit a crime, make sure there's no cameras around. I'm never going to get sponsored. Hi, Terry. Unless it's beer. If a beer company wants to sponsor me, absolutely. Okay. Let's go with horses. I think that a lot of the medical people in chat they're gonna like this clip, and the rest of us we're gonna like it too because of the social media aspect.
And then subsequent visits with him and a pain specialist a year or so afterwards.
In regard to your examination, Ms. Norris, did you do anything other than take her history, administer certain tests or procedures, and what else did you do with Ms. Norris, if anything?
Just asked her for her part of the story, what she believed happened at the time of the injury, what she's currently doing now as far as work, how she's utilizing the injured hand. Asked her to list the problems that she's bothered by, and then a focus exam of the right and left hands.
Based upon your interview with Ms. Norris, your physical examination of Ms. Norris, and after reviewing all of her medical records, do you have an opinion as to the type of injury you believe that Ms. Norris may have suffered?
Based on all the information, it looks like there was a crushing injury to the right hand, specifically at the level of the PIP or proximal interphalangeal joint area of the index, middle ring, and small finger, in which a forklift and pallet crushed her hand for a short period of time. There was no open wounds, no bleeding, no fractures based on the notes and based on the exams. And then there was subsequent treatment after that.
And you mentioned, for the jury, can you tell us what an interphalangeal digit or joint is?
So if we're looking at the hand, there's different joints on the fingers. Where the hand appeared to be crushed or stuck at was at this level, as indicated by the patient, and based on the records, that was consistent with where the level of injury was, into the fingers, just over that middle knuckle of the hand.
Okay. And you're showing the left hand, but for her it was the right hand. Is that correct?
Yes.
So what type of tests did you administer to Ms. Norris?
So initially just on inspection, evaluate the skin integrity, where there was some, looks like recent scratches, but no signs of infection, no drainage.
Forklift.
when I then performed a sensory exam. So essentially just have two hands held out and then just touch both index fingers, both middle fingers, both ring fingers, both small fingers of both hands to see if there's any differences between them. So that was a sensory exam. The patient was, numb and everywhere that I touched in all four digits, both the back side of the hand or the dorsal side of the hand. So here as well as here, and then her hand was resting in a normal position. It's called a normal cascade where the hand should be resting. I then asked her to flex the fingers and make a fist as well as to extend the hand. When I asked her to make a fist, she kind of leapt out of her seat and cradled her arm, which startled me. I kind of rolled back in my seat because I'd really not seen that before as a reaction to somebody just being asked to make their fist. She indicated that she's used to using only her left hand to bend her right fingers, and so that's why she did that. Upon calming her, I started by asking her to extend her fingers, and her arm was visibly shaking and trembling as she was doing that. Again, try to urge her to calm down, asked her if it was painful. She just said she couldn't extend her fingers. After we test for active extension, which she said she couldn't, I do a passive test, so I'm able to extend her fingers, which I was able to extend her fingers fairly easily. I then asked her to make a fist, close her fingers, and she said she couldn't. In feeling her arm, it seemed like she was flexing muscles that are not usually used for flexing the fingers up and down, and tried to distract her by talking to her about other things as she was making a fist, but she really felt like she couldn't move her hand. Her whole arm was shaking like this, trying to bend her fingers. Once she was unable to make a fist or move her fingers without any degree up or down or extension or flexion, as I was talking with her, I was able to fold her fingers down into her palm easily, passively. And so there was a discrepancy between her active motion and her passive motion, and she said she couldn't extend it up or down as she just physically couldn't do it. And then she was also complaining of pain at rest as well as the numbness that was there.
When she indicated she couldn't, or extend her fingers straight out, and you were able to do that with your hand. What did that tell you?
So usually if there's a difference between the two, if I can't do it and she can't do it, then there's usually some inherent tightness, scar tissue adhesions, arthritis, something that would not allow the joints or the fingers to bend normally. In her case, there was no active motion. So that's either the case where tendons are lacerated or cut, in which case the cascade, the resting hand, would be out of the normal anatomic view. Her hand was resting in a normal cascade. When I'm able to ask her to isolate and wiggle the fingers, she was able to wiggle them ever so slightly, indicating that the tendons were intact, nor did she have an open injury that would lead to any tendon lacerations. But really the active versus passive is whether, they can do that and whether there's something blocking the motion. Why, if I can't fully extend it because of stiffness of joints being locked into position or something, but that was not the case.
What's the significance of that?
It could be the individual is not putting forth effort, like just not making it out of choice, something that's not organic, not anatomically in the hand, either trying to be deceptive in the examination. There could be, whether it was a stroke or some other disconnection with, the nervous system, or if they have an injury where they have a sharp laceration someplace where things are not connected and they can't, open and close that would be some indication. But again, there would be other factors where there would be weakness, or there would be fingers out of place, or there would be one finger that can't bend, not all of them all uniformly in the same way. So you're just looking for objective abnormalities on the exam.
And when you folded her hand down and then you folded her hand so her fingers were flexed straight out, did she exhibit any pain behaviors when you did that?
When initially she would say that it was hurt, and then I would ask her to tell me about, another part of, the history or the exam, or try to distract her. As I was doing it more and more, it seemed like it wasn't as painful.
And what does that tell you when you do that exam and it's not as painful when you do the distracting procedures?
Typically, if, upon, someone being distracted and then they say it really hurts, but then they can do it quite easily with their eyes not viewing that, again, there's some form of either deception or anxiety or something that's non-anatomic, something that's not in the hand that's causing that to be limiting or to be painful.
Okay, so we got it so far. She was at work. She got hit by a forklift, and she crushed her hand. All right? Nobody doubts that her hand was crushed because it was stuck there, and the forklift driver saw it and then backed away, and then she could pull her hand out of there. So, I mean, it happened. The forklift did crush her hand. All right? But we don't know to what extent. And we're going to look to social media to see how badly it hurt. All right? But ladies, guys, just give me 2 seconds, okay? Because this is so exciting that for the ladies, I'm telling you. All right, ladies. See my normal shirt? Are you ready? Wait. Ladies, look. Can you see I got pockets? I'm so excited. I just found that out. Isn't that the coolest thing you've ever seen in your entire life? It has pockets. Sorry, here we go.
And in her case, you talked about, or in general, you talked about procedures or situations where somebody may have problems flexing or making a composite fist, and you said if they're had a laceration or a cut, that might factor into that. Did she have any of that?
No.
Okay. Now, are you familiar with Dr. Pope?
Yeah. Yes.
And he works for OSMC?
Yes.
Is he too a respected orthopedic hand surgeon in this area like yourself?
Yes.
Is having a patient, requesting a patient who has a hand injury such as Ms. Norris had, is requesting them to do a standard test, a composite fist standard test, something that's pretty standard to do?
Yeah, you want to check range of motion with them to see what deficits they have.
Okay. And did Dr. Pope ask Ms. Norris at her first appointment with him on March 5th, 2021, exactly 1 month after her injury, to make a composite fist?
Yes, I believe all of the visits in the first 3 or 4 months, there was documentation of range of motion that was normal or full, and even commented that the range of motion was quite good.
So in other words, Dr. Pope was able to, or Ms. Norris was able to make a composite fist whenever she saw Dr. Pope.
For those first, up until the April or May when he released her, for those first, from February to May, those were all full motion, full fist, composite fist motions that were documented.
Is that significant that she had full range of motion in those first 4 months?
Yeah, for the mechanism and for what the patient's complaining about, I would expect if there was some stiffness and loss of motion for that to be immediate or in the early interim following the injury. I would not expect years later for all of a sudden the stiffness and loss of motion to result. The individual had pain, had difficulty with moving day one, but even within the 2 days and 1 week, there was excellent motion that was documented by the work comp office. She was sent over for having some numbness, some tingling, which appeared to be more on the milder side early with the visits. And so, for a hand surgeon, a solicitor's Dr. Pope, to document normal motion and to actually provide work restrictions of 0, meaning that able to work full duty without any restrictions, those usually indicate that it's a more milder injury that doesn't require restrictions based on limitation in motion or the amount of pain that's occurring at that specific time.
And you mentioned a moment ago in your answer that she was sent over. You mean she was sent over from Concentra, where she had been treating, to OSMC?
Yeah, she was referred there, I think, after the second visit with them.
So Dr. Pope testified in this matter regarding his ability to make a composite fist that, quote, I would not expect if you could do that a month after their injury for you to then lose that ability. It would be atypical, end of quote. Would you agree with that statement?
Yes.
Further, Dr. Pope testified in this case that, quote, but in general, if a person is already able to make a composite fist at that early stage, I would expect a good outcome and a fairly quick good outcome, end of quote. Would you agree with that statement?
Yes.
Additionally, based upon your examination of Ms. Norris and after reviewing all of her medical records, do you have an opinion as to whether she suffered a permanent injury from the alleged injury of February 5th, 2021?
I mean, I would be basing it more on the early notes and documentation in which the individual had full motion and had some residual numbness and tingling that I would expect to improve over time, not worsen. And so, whatever Dr. Pope had documented at that last visit with the permanency of the impairment, which was a couple percentage points of the hand and upper extremity, I think would be in reason if the numbness, tingling, some intermittent tingling sensitivities were occurring at that time, but I would not expect there to be a permanent impairment as it pertains to lack of motion, unable to use the hand in the capacity that was the complaints when I saw the individual in September.
Nope, that's not worse because we can just take stitches out. We can. So we have pockets.
You start September of 2024.
Yeah.
And is that opinion based on a reasonable degree of medical certainty?
Yes.
Okay. Did you find discrepancies in her version of what happened on the day of her, what she told you happened on the day of her injury compared to any medical notes that you might have reviewed?
When her hand was crushed, I asked her how long it was crushed for, and she said it felt like forever. I tried to get a more specific amount of time, and she said it must have been at least several minutes. I asked what she was doing for the several minutes that her hand was supposedly stuck. Was she shouting? Was she yelling? Was she asking for someone to move the truck, the pallet? And she said she couldn't really remember what was going on. The note from the work comp clinic that day has it listed that the hand was pinned for up to a minute. And so that would be a discrepancy in time. I asked them if, there was any broken bones. They were told that there were not. They don't remember if there was any fractures or broken bones. But she said that she was told that she had nerve damage. That was those discrepancies as far as the duration of the injury.
Did you do something called Waddell testing when you saw Ms. Norris?
Yes, Waddell signs are findings during a physical exam that can be found consistently in individuals or circumstances where there may be a non-organic or a non-anatomic cause for the symptoms or the issues. In this specific case, there was significant hypersensitivity. So, I was just, when I was mentioning I was doing the sensory exam, when I was just brushing my fingers across her fingertips, she would withdraw and say, like, that's super painful. And that was just extreme because for two of Waddell's signs, one is that it was on all four digits front and back, which is actually 3 different nerve distributions. So I wouldn't expect that injury to be that diffuse. We call it like a stocking glove. I would expect it to be more in one nerve range, and someone without a knowledge of anatomy may just say that the entire hand hurts, whereas a specific injury, it may be on one part of the finger, one part of the hand, because the nerves are actually on the lateral aspects of the fingers on the palm side. She was indicating that her most significant points of pain were on the back of her finger. And again, just by gently brushing her hand, she was writhing in pain, which is a Waddell sign of an overreaction to a seemingly light stimulus. And so, the overreaction, the non-uniform or non-anatomic distribution of the sensory issues, those were, and then the shaking or the trembling where I'm trying to just simply ask her to wiggle her fingers, where her whole arm was being used. Those were the 3 signs that can just help to provide some objective support for what I'm believing to be an inconsistent exam.
And you talked about non-anatomic distribution. Can you tell the jury what you mean when you say something has a non-anatomic distribution?
Something that's not inherently wrong with the items or the anatomic parts that move the fingers. So not muscle, not bone, not tendon. It could be either, again, conscious decision making of not bending the fingers or trying to do the opposite. Those would be, some examples.
So, for example, if her finger was broken, that would be an anatomic, and had pain as a result of you touching her finger. That would be an anatomic finding as opposed to a non-anatomic finding.
Yes.
Okay.
Nothing wrong with faking every once in a while.
Now, Dr. Pope did know Waddell testing at the early stages after he was seeing her initially. Would it be important for a doctor, a hand surgeon, to do Waddell testing if somebody just comes to them within weeks of a hand injury?
No, those aren't common. I wouldn't say that they're tests, they're signs, they're findings on a test. And so I wouldn't necessarily see that would be something that you would document or look for in the immediate aftermath of an injury when there's bruising and swelling. I think that's more difficult to discern. But I don't necessarily test to see if trying to make someone tremble are they trembling or not, sort of thing. Those are the signs that you have, but that's not something you traditionally see in the first few months or looking for in the first couple of months after the injury because you're trying to treat the acute problem.
Upon examination, you mentioned earlier that you examined both Ms. Norris's left hand and right hand. Why do you examine both hands if she comes to you with just an alleged injury to one hand?
It's great to compare. It's great to have two different sides. And so if there is a significant nerve problem, a nerve injury, there can be changes to the overall hand complexion. There can be abnormal sweating, abnormal hair growth. There can be a more red sausage-like digit appearance to the fingers. If one hand is excruciatingly painful, constant pain, can't use it, then I would expect it to look less used. Either they wear gloves, they wear mittens, they protect it from the sensitivities that are there, which just makes it look different than the other hand. And then it's just great to be able to compare range of motion strength to something that hasn't been injured.
And when you examined both of Ms. Norris's hands, what did you find?
They looked pretty similar between the two as far as at rest. They both looked like they had the same amount of wear and tear. There was no significant nerve findings. That would be an example of what's called CRPS, or chronic regional pain syndrome, which is that abnormal sweating, hair growth, redness, just reaction to somebody having a significant hand injury.
So we looked at both of Ms. Norris's hands. Based on your experience as a doctor, did it appear that she had been using her hands equally, if that's a fair way to put it?
Yeah, she had some what looked like recent scratches on her hand. I just asked her what was that from, and she said, "Well, I live on a farm."
Okay. Did you do any muscle strength testing?
It was really hard to. The fact that she was not able to move her fingers at all, other than keeping them in one position, I really wasn't able to test them at all.
Okay. And in regard to her, Ms. Norris's complaints of pain, objectively, did your exam findings match up with her complaints of pain?
No, it seemed to be very intermittent, where at first, when I first touched her hand, she would writhing, withdrawing her hand. As I was asking her to bend and move and talking with her and bending the fingers, it seemed like it wasn't as painful. Where she pointed to the pain was on the
Dr. House would throw something at her and make her catch it.
dorsum or back of the fingers. Initially had pain here. As I touched them, as talking with her, it seemed like they weren't constantly painful from what she was saying, that she was having 6 out of 10 at rest, and then unquantifiable pain whenever she uses her hand.
So did it seem that her complaints of pain switched from
I think we're going to hear more about that.
the dorsal side of her hand to the inside of her hand?
It just seemed like when we were focused on it and looking at it, they were more exaggerated. And then when there was distracted or when, talking or, getting up, walking out of the hallway and stuff, it seemed like the hand was moving and functioning, without difficulty.
And I believe you testified earlier that's something you do.
And that's what I tried to say at the beginning, Lori, but badly. She did get her hand crushed by a forklift. That did happen. She's not faking the whole accident. The accident, and it wasn't just like it hit her and moved on. It had pinned her there for a bit. How long? We don't know. I mean, are you going to start counting the seconds if your hand is being crushed by a forklift? So that actually did happen.
As a doctor, you watch the patient walk in and walk out to see if their behaviors are consistent or inconsistent with their presentation to you.
Yes.
Do you have an opinion as to whether you believe that Ms. Norris may have been exaggerating her complaints of pain?
I believe that the exam and the severity of pain was exaggerated in my visit with her, yes.
The forks. There was a pallet on them.
Dr. Pope testified that Ms. Norris would not require ongoing treatment for her symptoms. Would you agree with him?
Yes.
If Dr. Pope testified that it was unlikely that Ms. Norris's symptoms of pain or numbness or any other symptom could worsen over time, would you agree with him?
Yes.
Did you believe that Dr. Pope's care of Ms. Norris was reasonable?
Yes.
And I believe you testified that Dr. Pope saw her over like a 4-month period of time, like 4 visits monthly.
Yes.
Is that your memory?
Was that
Were
a
those
lie?
number of visits
Hold on, guys.
reasonable visits monthly?
All right. Is this body language of someone who's lying? Ready?
Yes.
Is that your memory?
Look.
Were those number of visits reasonable for this type of injury in this circumstance?
Yes, 3 to 4 months follow-up for observation and resolution is appropriate.
Can someone who says or has chronic pain, can that chronic pain dissipate or go away over time?
Yes, I think pain can change over time based on the mechanism or why it was there to begin with.
Did Ms. Norris indicate?
Why all of a sudden is the doctor lying? What is going on that makes you guys think he's up there lying? Now he's lying for the insurance company. Come on, guys. He's a doctor. Hold on. There's more. I told ya. There's cameras.
Whether she had any weight restrictions or couldn't lift certain weights?
When I saw her, she said that anything more than a cell phone bothers her, and it's hard to carry bales of hay to...
Maybe. But remember, she cannot move it in his office. If he goes anywhere near it, she flinches and shakes. Okay? Now wait, just keep that in mind.
Carry buckets at the farm, and anything over 5 pounds causes significant pain.
Doctor, I'd like to show you some video clips of videos that we have already agreed could be entered into evidence. And after each one, I'll ask you some questions, all right? So let me prepare this to show you. Can we go off the record?
We're off the record.
Okay.
It's 4:45, 4:47.
As indicated, Doctor, I wanted to show you some videos and then ask you to comment on them. The first video will show you is a video that Ms. Norris posted on her Facebook account on September 2nd, 2023. It's Exhibit M, and I will show you from 0 seconds of that exhibit to 2 minutes and 46 seconds. Can we go off the record for a second?
We're off the
Okay.
record. The time is 4:48. We are back on the record. The time is 4:48. Oh my God, I'm getting away! It's not literally right over my shoulder. It's like I'm right in the scary. Now you're watching. Come on, dude. Come on, move. Ignore me, you guys.
All right, I know this one is she's using your hand, but there's more. There's more content. There's more videos, and those are the ones that do it for me. That is true. We all have pain, and we still have to go to work every day. I know, like my threshold for pain is so high. I stood maid of honor to my best friend the day after I had a baby. And I went to the reception and everything. Um, yeah, so I would be able to, if I crushed my hand, I would be able to work like she is working. However, when I was in the doctor's office, I wouldn't have flinched if he barely touched me. And if he told me to make a fist, I would make that fist.
Okay, doctor, after looking at this 2 minutes and 46 seconds of video, is the presentation of how Ms. Norris uses her right hand in this video consistent with how she presented to you on September 19th, 2024?
No. She was complaining of significant hypersensitivity, pain with use of the hand, saying that she would not be able to grip or grasp, wasn't able to make a composite fist, and in the video she's easily holding a wheelbarrow, shoveling horse manure and what appears to be much more than 5 pounds of weight in that shovel with ease, crawling underneath the horse, using it with one hand, with both hands individually. Doesn't seem to be favoring the right side. There's no gloves or protective gear on the splint to try to limit the amount of exposure. So I would say that this is not consistent with what the complaints were when I saw her a couple months ago.
All right, Dr. Moon, pull up a second
Cartwheels.
for you to look at. And this is a video that should last approximately 1 minute and 25 seconds. It's was posted on Ms. Norris's Facebook account on September 2nd, 2023, and it's Exhibit M, Video 2. From
This is the one that did it for me.
1 minute 35 seconds to 3 minutes.
No, this isn't the one that did it for me. There's other ones. Does this horse have an upside down heart on his ass? I think he does. It's just like my tattoo. That's a very good question, Bren. She posted these on her social media.
All right, doctor, after looking at this 1 minute and 25 seconds of video, is the presentation of Ms. Norris, how she uses her right hand, consistent with how she presented to you on September 19, 2024?
No, similar to video one, she is handling and using a shovel, seemingly without pain, with what looks like a good grip around the shovel handle, and moving without challenges as it pertains to the right hand.
Fletcher, you're going to be the one that decides this for us. It's all you, Fletcher. With your hand injury that you're living with right now, could you muck out that stall? Could you shovel the poop into the thing like she did? It's all about you. Yes or no?
All right, I want to show you what's plaintiff posted on her Facebook account, again on September 2nd, 2023. It's Exhibit M, and it's video 3 from 0 seconds to 1 minute and 27 seconds. And then I think it rolls into, skips to 2 minutes, and then there's another 36 seconds from 2 minutes and 36 seconds.
Listen. Hi, Cold.
Come on, there's something on there. I gotta see. That was pretty cool, dude. That was pretty cool. Okay. Oh, next week is so awesome here.
I mean, we're all watching. A doctor.
Oh, dude, seriously? Come on. You guys are killing me with it. Come on, we're gonna get this fight. You guys' supervisory skills are a little undesirable.
Doctor, after looking at this 2 minutes and 3 seconds of video of Ms. Norris, is the presentation how Ms. Norris uses her right hand in that video consistent with how she presented to you on September 19th, 2024?
No, in this video, she was holding a shovel only with her right hand. She was equally using the wheelbarrow with both hands, pushing, pulling, shoveling, seemingly without pain or loss of motion.
Doctor, I want to show you what's been marked as Exhibit G, which are video clips that Ms. Norris posted on her Facebook account on August 27th, 2023. And this video is from 0 to 6 seconds of video 1 on Exhibit G and 24 seconds to 56 seconds on the same exhibit, and 1 minute 37 seconds to 1 minute 48 seconds. So it's a total of 49 seconds, but I believe it all runs together.
I think these are the videos that did it for me. I think. Nope. Nope, these aren't it. Oh, I think the second one here is epic. Here we go. Here we go.
Just clean there, you know. Hey.
Oh, that's the wrong video.
Actually, Doctor, what I showed you was Exhibit G, which was a video posted on Ms. Norris's Facebook account on August 27th, 2023 from marker 3 minutes and 5 seconds to 4:17, which is a total of 1 minute and 12 seconds. And looking at that 1 minute and 12 seconds of video of the plaintiff is the presentation of how she used her right hand consistent with how she
Correct.
presented to you on September 19th, 2024.
No, she was with a closed hand holding on to reins of a horse, guiding and steering the horse in the stable that we can see, mounted a horse using both hands, and also pushed a heavy wheelbarrow with both hands, including the right hand.
Okay, Doctor, the video I want to show you now is I'm going to show you a 6-second video, a 32-second video, and an 11-second video. This is from 0 to 6 seconds, 24 seconds to 56 seconds, and a minute 37 to a minute 48 on Exhibit G, which Ms. Norris posted on her Facebook account on August 27th, 2023. And then I will ask you some questions. Here is the first 6-second presentation. Okay, and that 6-second presentation was her presentation in that video different than how she presented to you on September 19th, 2024?
No, with her complaints of stiffness and pain, not being able to carry much more than a cell phone, she was carrying a shovel in this video, walking off the screen with just it being held with her right hand fairly easily.
Come off the record for a second.
You're off the record. Is 5:05. You're back on the record. The time is 5:09.
Okay, Doctor, I want to show you what's been marked as Exhibit G, Video 2. And this is a video clip that Ms. Norris posted on her Facebook account on August 27th, 2023. It lasts from 5 seconds to a minute 36.
Wait. You lied to us? Your name's not Junebug? Why would you lie?
I'll ask you to look at this and I'll ask you some questions afterwards.
Okay, this video is better. I think this is it. Way better.
Okay, doctor, in this 1 minute and 31 video, 1 minute and 31 second video of Ms. Norris, is the presentation of how she uses her right hand consistent with how she presented to you on September 19th, 2024?
No, she was again using a shovel to lift up manure and farm debris, and then was able to use both hands to mount a horse without protecting or favoring one versus the other hand.
Okay, next I want to show you, doctor, a video that Ms. Norris posted on her Facebook account on September 2nd, 2023. It is Exhibit L, and it goes from 0.0 to 28 seconds. I'll show you this video, then I'll ask you some questions.
They're always across the street. Thank God you actually stayed like you're supposed to. Oh. I know. You did a good job. Come on, buddy. Oh, my ass. Oh, my God. Oh, so bully.
Doctor, after looking at this 28-second video of Ms. Norris, is the presentation of how Ms. Norris uses her right hand consistent with how she presented to you on September 19th, 2024?
No, she's making a strong composite fist around rope or reins and dismounting off of a horse and using both hands equally to guide the horse.
Doctor, I want to show you a video clip that
Oh no.
Ms. Norris posted on her Facebook account on July 31st of 2024. It is Exhibit I, and I'll show you from 0.0 seconds to 2 minutes and 42 seconds, and then I will ask you some questions.
I'm going to show you why having a steamer is fantastic. I'm going to take the lid off.
This is the one that did it for me, because I know with me, I mean, if I'm in pain, then I can take the garbage out and mop and things like that. I don't know. That's like you're gripping hard, but what she's doing here is intricate little movements with her hands, and that would be, if my hand was crushed, that would be too much for me. She doesn't have to do this. This isn't, she's posting a video on her social media. So if I was in pain, I couldn't do.
We're going to use distilled water that's in the cup. Got your little funnel. Put that in here. See if I can do this one-handed while holding the phone. And put your water. I've already plugged it in, so it gets hot quick the moment you plug it in. So definitely don't leave it plugged in unless you plan on using it right away. Put your cap back on. It's a screw-on cap. Sorry about the furnace. Tighten your cap. It comes with a bunch of different ends. Like this piece and this piece goes together for cleaning windows, but we're not going to use those. And there's a bunch of tips that you can use. This is one of the end pieces you can put on, but we're not using that one either. We're going to use this piece right here because we want the longer flexible end. And you'll see right here. And inside, there's little clips that line right up with these caps right here. Yeah, I can't really do this one-handed, but let's see. Click it into place.
You mean that hand right there?
All right. Now, we could use these little tips right here, but it's just not fun. But what we're going to be doing is, you know how your washing machine gets all disgusting and filthy? All right in here. All that grossness. Well, we are going to clean that using the steamer. And unfortunately, this is going to require 2 hands for me to do. So we'll be back in just a moment. Okay, clearly we're not done yet. But, see, that shows you the difference. And at this point, I'll put one of those little brushes on the end to get like the rest of this stuff here off, and to get inside this cup and stuff and around it. But it makes it look a lot better than dealing with that disgustingness.
Video.
Doctor, after reviewing that 2-minute and 42-second video of Ms. Norris, is the presentation of how she uses her right hand consistent with how she presented to you on September 19th, 2024?
No, in this video, her left hand is predominantly used to hold the phone. She's demonstrating very normal
Thank you, another
dexterity,
Smith.
coordination
Thank you.
by holding small objects interchangeably with her fingers. Can easily see all the fingers are bending down quite normally, is able to tighten and screw caps on this device, and does not appear to be in any significant pain or have any limited motion based on this video.
All right, so she cleaned her washing machine lint thingy with a steamer, whatever. My shirt has pockets. Yay, Lacey. Lacey's got a gold star. Lacey's got a gold star.
Doctor, this is the last video I'm going to show you. I will represent to you that this is a video clip that Ms. Norris posted on her Facebook account on September 2nd, 2020.
Linus, watch this. Sorry, guys, Linus was late. Linus, see my shirt? See my regular flannel? It has pockets. Look, I'm taking my lipstick out of my pocket. Oh my gosh, I love this shirt. I want to be buried in this shirt.
23, it is Exhibit M, and it's her mounting a horse, and the video goes from 16 seconds to 48 seconds on Exhibit M.
You're a little bit taller. Easy.
That was the video that I was waiting for. That I thought was 17 videos ago. That was the one.
After looking at this 32-second video of Ms. Norris, is the presentation of how Ms. Norris uses her right hand consistent with how she presented to you on September 19th, 2024?
No, she appears to be using both hands to pat.
Hand After looking at this 32-second video,
Ooh, you're a little bit taller. Easy.
after looking at this 32-second video of Ms. Norris, is the presentation of how Ms. Norris uses her right hand consistent with how she presented to you?
I just want to point out that out of what I just showed you, they started talking about cleavage. I didn't even notice that, but they did.
On September 19th, 2024.
No, she appears to be using both hands to pat the horse and use both hands to bear her weight as she mounts onto the horse without any evidence of having significant pain, hypersensitivity, loss of motion. Appears to be using both hands with ease.
To a reasonable degree of medical certainty, doctor, is it your opinion? What is your opinion as to whether plaintiff's current complaints of subjective pain as to whether they're related to her injury of February 5th, 2021?
I would not correlate her current complaints with an injury that was prior to these videos and over 3 years ago when she had normal motion within days after the injury, and drastically different presentation here now years later.
Okay. Thank you, doctor. I have no further questions.
So are you, CJ?
Doctor, let's start with a couple things that I think we agree on. The original injury that Amy presented to Dr. Pope with, you agree that injury is a result of the February 2021 accident at Heartland RV, correct?
Yes.
Okay. And that's to a reasonable degree of medical certainty.
Yes.
And you agree that the treatment that she received at Concentra, at Goshen Hospital, which I think was the x-rays, and then at OSMC, that's all related to the treatment, correct?
To the injury, yes.
All right. And so as we sit here now, there's no dispute from you, doctor, that Amy was injured as a result of this incident.
Yes.
Would you also agree with Dr. Pope and Dr. Schrock, who testified that it was a nerve injury
No.
that she suffered?
There was a crush injury to her hand, and 4 to 5 months afterwards, there was still some mild complaints of numbness and tingling that can be deemed nerve-related.
Okay. And earlier, when you were testifying about permanent injury and permanency on direct testimony, you indicated, I think, that you would believe that she could still have that numbness and tingling today as a result of the February 2021 accident. Is that correct?
It's for somebody for this type of injury who was still having numbness and tingling within days afterwards, and for the first few months at that May visit when Dr. Pope released her, gave some permanence to those specific issues that she had.
Okay. And so when we say permanent, it could be the rest of her life that she has the numbness and tingling.
It could be. Typically with nerve and crushing injuries, it tends to improve and can improve for 1 to 2 years after the injury.
Okay. And if it hadn't improved in 2 years, so by February of 2023, that's getting outside the scope of where you'd expect recovery to occur.
Yeah,
Nan, you missed it. It was all medical talk.
I would expect it to be not worse than what she had at the time of the April-May visits with Dr. Pope in 2021. But yes, after 2 years, whatever remaining cold sensitivity, some, the mild numbness, tingling, altered sensation can be deemed permanent.
Okay. Now, Doctor, you mentioned earlier that you knew Dr. Pope and you thought he was a respected member of the community, correct?
Yes,
Do you know Dr. Schrock?
I know he is, yes.
Is he a respected doctor in the community?
Yes,
Okay. And Dr. Schrock's a pain management doctor, correct?
yes,
Is that different than a surgeon?
Same.
yes.
What's the difference between a pain management doctor and a surgeon?
Pain management doctors typically don't do surgeries or more invasive work. They provide medications and try to treat more chronic related or nerve, spine, brain related issues.
Okay. And Dr. Schrock prescribed some medication to Amy for her hand injury, the nerve injury as he described it. Would that have been appropriate in your opinion?
I would defer to a pain specialist.
Okay. And if Amy continues to have some pain medication she's getting to this day, is that consistent with?
Objection. I'm not sure there's ever been any evidence presented that she's still getting pain medication to this day.
Okay. If Amy continued to get pain medication following her treatment with Dr. Schrock, would that be consistent with that treatment?
Can you clarify? Sorry.
Sure. If Dr. Schrock thought it was appropriate for her to have pain medication and she obtained pain medication continuing on, is that appropriate for her treatment and care?
I would defer to a pain doctor as far as what's appropriate pain medicine. Patients can get pain for different reasons. There's not always a inciting event. Sometimes patients just have pain, whether it's arthritis, advancing age, different issues. And if a surgeon can't treat it surgically, some surgeons opt to refer them to a pain specialist to see if they can manage some of their symptoms elsewhere.
Okay. Now, is nerve injury, nerve pain, is that something that can occur spontaneously with no cause?
Usually there's an underlying cause, whether it can be something as a vitamin deficiency to arthritis to, a pinched nerve in the neck to a crushing injury. Carpal tunnel is a common nerve problem. There's 130 different reasons why that can happen.
Okay. But usually there's some trauma that causes nerve injury. Is that fair?
Not necessarily. I mean, carpal tunnel, it's rarely trauma.
Okay. It's repetitive use. Typically.
That's, controversial, but there's, it could be diabetes. It could be, just overall health that can cause carpal tunnel syndrome.
Okay. Now, you received medical records from the defendant, correct?
You love them long time.
Yes.
And some of those medical records predated the February 2021 incident, correct?
Yes.
And some of them were after the February 2021 accident.
Yes.
In your review of any of the medical records that were before February of 2021, did you see any medical history that would indicate that the nerve injury that Amy presented with was from some pre-existing condition?
No.
And in the medical records that you reviewed after February 2021, did you see any medical records that indicated there was some other trauma or some other cause that might have caused or contributed to the hand injuries that you visited with her for?
There is no evidence in the documentation of like a new injury or a new problem.
Okay. Now, we watched a bunch of videos a few minutes ago. Is that the first time you'd seen those videos?
I saw them, 4 days ago?
Okay. They were provided to you by the defense?
Yes.
And were they sent to you by email? Did somebody bring them to you? How did you receive them?
Email.
Email. So that was not the first time you had watched them?
Correct.
Did you have an opportunity to talk to anyone on behalf of the defendant about what you saw in those videos?
They were sent to me separately, so I didn't really talk to anybody about the videos, no.
Okay. Did you watch them?
Yes.
Did you watch them once or multiple times?
I watched them on Friday, and then I watched them again today around lunchtime to review them again.
Okay. And then you watched them again as we went through.
Mm-hmm.
Is it fair to say all but maybe one of the last video that you saw that they're all farm-based activities and working in a barn, riding a horse, that type of thing?
Yes.
And Amy told you when she met with you that she lived on a farm, right?
Yes.
And she told you that some of those rough spots on her hands were from, she lived on a farm, correct?
Yes.
And so is that consistent with your meeting with Ms. Norris when you met with her in September of 2024?
No, she said that anything lifting more than a cell phone would cause great pain, that she lives with 6 out of 10 pain at rest, and that she can't do farm chores such as baling hay and doing the things that I saw in the video.
How much does a bale of hay weigh, doctor?
She also mentioned lifting buckets, so that was just a specific example.
Okay. Do you know how much a bale of hay weighs?
I don't.
Did she tell you if there was anything in the buckets she tried to lift?
She specifically told me she can't lift more than 5 pounds with excruciating pain. I know how much 5 pounds is.
Okay. All right. So, and you remember her saying specifically she can't lift more than 5 pounds without excruciating pain?
Yeah, because I usually, for these IMEs or second opinions, I try to garner, in case a question's asked, like what would be their work restrictions, what are they able to do? So I specifically ask, what is a specific weight that is too much for you? For pretty much every individual. It's not that they openly give that, but I ask them. And in this case, they mentioned 5 pounds.
Okay. All right. The fact that she was working on the farm is consistent with what she told you, correct?
Yeah, I asked her how she got the scratches, and she said, well, I live on a farm.
Okay. Now, you mentioned, well, let's talk about this. You mentioned that it was an independent medical exam, correct?
Yes.
Let's be clear on what it's independent of, okay? And I want to make sure this is what I believe you told Amy, that it's independent of any medical care, correct?
Yes.
It's independent of any medical treatment, correct?
Yes.
It's independent of any doctor-patient relationship, correct?
Yes.
It's independent of any medical advice, correct?
Yes.
Now, let's talk about what it's not independent of. You were hired by the defendant in this case, correct?
They asked me to perform the IME, yes.
Right. And you did it at their request.
Yes.
And you were paid for it.
Yes.
And you were paid for the original report, it was $1,750, correct?
Yes.
Is that your standard rate for a report?
Yes.
Okay, and you've done this before?
Yes.
It's not something new to you that you do a report for a defendant in a case like this?
It's not frequent, but yes, I've done it before.
Okay. And you've done it in work comp claims and injury claims like this?
Yes.
Okay. And when you went through this particular case, you also charged for the day, correct?
Yes.
And how much are you charging for the day?
SBO has a flat fee. I don't know what it is off the top of my head.
Is it more or less than the $1,750 that the report was?
It would be more than that.
Okay. And did you charge to watch the videos on 4 days ago when you got them?
I haven't charged for that, no.
Okay. Was there a separate charge to review the medical records that you received?
Hold on a second. Yes, he did. Yes, he did charge to watch those videos. We're not stupid, doctor.
No, it's it includes the chart review and time to do that and to write up a report.
Okay. And so when you met with Amy, how long did you meet with her?
Probably about 15 to 20 minutes.
Okay. And so probably less time than it took for us to watch the videos today.
Around the same, I don't know how long that took. It seemed like it took a while, but yeah, I would say 15 to 20 minutes.
Okay. So you don't know how long it took today as we went through the videos?
Each specific video took 1.5 to 2 minutes, but to pull them up and to watch them, took added time. So.
Right. So you don't know how long it took?
I wasn't counting time, no.
Okay. Did you meet with counsel for defendant today before the deposition?
No.
No. Okay. Have you met with him before today?
Yes.
Okay. When did you meet with him?
Friday.
Friday. When you got the videos?
He said he would be sending them over. I hadn't looked at them when he called me to talk to me about them.
Okay. And how long did you meet with counsel for defendant on Friday?
30 minutes.
30 minutes.
Not in a billion, cajillion, bazillion years would I be able to read that. Hold on. Where is it? Oh, I lost it. Someone said spell his last name. Oh, there we go. I think it's Puller. Sampler? I don't know though, it's so blurry. How did you see that?
Okay. Now, you talked about something called Waddell signs, correct? Is that yes?
Yes.
And Waddell signs, as I understand it, they were originally designed for back injuries, correct?
I mean, there's a Scottish surgeon who first described it, but there can be attributed to other body parts. I don't necessarily test like a leg raise or pushing down on the head, things that would be unrelated to hand injuries. It's really looking for disturbances that are out of proportion from what the exam is. We sort of coin them as Waddell signs.
Correct. And so when Waddell signs were created, it was originally done for neck and back injuries, correct?
Yeah, I don't know the historical specifics of what that is, but I know that they're used throughout the medical societies in the world today.
And one of the things that we've seen as the medical societies have used it is there's a difference in terms of the reactions or the number of signs that appear based on a person's age. Have you seen that?
No.
You haven't? Okay. What about sex? The gender of the person, does that make any difference in the Waddell sign numbers?
I'm not sure.
Okay. And is it also true that if you have a patient that comes in and they have one Waddell sign, that's clinically insignificant and would show that they passed the test?
Yeah, you want to see more than one specific finding, and within the hand exam, that's limiting because a lot of those other tests are not on that body part. So you're just basically trying to correlate the history, physical exam findings, and then to provide some other substantial evidence as it pertains to somebody can't move their hand. How can you prove that they physically can't do it versus they can? You look for other signs, such as those Waddell signs of
Very
somebody
good, Donna.
actively using body parts or seemingly more dramatically than what you see when you see 125 patients a day, ask them to make a fist. Something's out of context. How do you document that? And how do you report that?
Right. And so one of the things we know is that if somebody has multiple Waddell signs, it could be that there's some kind of a malingering effort, but it can be from anxiety.
Yeah, that's why you say it's non-anatomic.
You came to the right place. Wait till you see the video in the next video.
So you try to put the full picture. It could be from a variety of things.
Okay. And so if we look at this situation, when Amy came to see you, she'd never been, you see no indication in the records she's ever been involved in an IME before, correct?
I don't think so, no.
Okay. And you had never met her before?
No.
And she walks into your appointment and the first thing you tell her is, hey, look, I'm not your doctor. I'm not giving you any medical care, any medical treatment, doing anything on your behalf. I'm just here to talk to you. And then, is that correct? That's how you started, right?
Yeah, I usually sit down and in a comfortable setting just introduce myself and say that, we're just here to answer some questions and try to appropriately establish what the basis is for that visit.
Okay. And then you tell her, if I do anything today that
Absolutely
causes
not,
you pain,
Raven.
I'll stop.
Nope.
Right?
Yes.
Okay. You told her that.
Yes.
And so when she complained of pain and you continued to do the passive motion with her, that was inconsistent with what you told her because she said it hurt and you continued to touch.
The first time that I did that, I did stop and back off and explain, why does that hurt? Why did you lunge at me? Why did you sweep your other arm around to try to grab your hand? And, as she was explaining that to me, then I would kind of go back to the exam and then, attempt to do it again. And then which each time that I did that, there was less and less pain to the point where I was showing her that we can make a fist and there was no pain associated with that.
And that could be consistent with the fact that she was getting more comfortable with you.
DUI. No, just kidding. It's workers' comp. There's the words.
I don't find myself to be a very dominant presence in the office, and whether she was feeling nervous or anxious, I did not see any signs of that. There was no stuttering of speech. It seemed like she was very much able to throw out whether the driver was flirting with the blonde or speaking English or not, and it seemed like she was very collected and comfortable with explaining the story in her point of view.
Are you a psychologist?
No.
Okay. Now, I do want to ask another question. You talked a little bit on direct examination about the length of time her hand was being crushed.
Yes.
And you made a mention that there was some inconsistency between what she told you at the examination that you did and the earlier medical records. And originally you said, if I remember correctly, you asked her that and she said it seemed like it lasted forever. Mm-hmm. Is that correct?
Yes, that's what she initially said.
Right. And when you talked to her, you knew what her original medical records said, that it was less than a minute, correct?
Well, there was two records. The initial day of said less than a minute.
Hold on. Her hand was being crushed by a forklift. And you're bothered by how long she thinks it might have lasted? Her hand was being crushed by a forklift. Of course it felt like it was forever.
And then there was a subsequent visit that said for maybe a couple minutes. So there was a discrepancy that I was trying to clarify.
Okay. And so the one record said it was under a minute. Later on, you see that it was a couple minutes.
Yes.
And is that significant from a medical perspective if it was 59 seconds or 125 seconds? Is that significant from a medical perspective if her hand was crushed between the pellet and the bar for that length of time?
Yes.
How so?
Well, I see patients that have hands caught in a press and they might need a valve or a stop device in order to pull their arm back out of that.
And that's true. I worked in a press room for 7 years, and that's true. When you're working in a press room and someone gets their arm stuck in a press, which crushes everything, you have to leave them there. You can't get them out. You have to leave them in the press. You would think, oh, just reverse them out. But if you reverse them out, you'll explode everything. You have to leave them in the press and try to keep them calm until somebody can come and take the machinist can come and take the press apart. And then you can let them out. So they just have to sit there in the press. It's terrible.
Whether it's stuck for 10 seconds, would be less of a crush phenomenon, less of ischemia time, less of trauma to that hand, versus it took 8.5 minutes for a crew to pull their arm out. So I would say that within the scope of a crush injury, the time matters. But if it's crushed between these two doors for 10 minutes versus another mechanism, that plays into view. So there's lots of different points that are important for a crush injury, one of which is the amount of time.
And isn't it fair to say, doctor, that many times if you ask a person if their hand's getting crushed, that they don't really have a great recognition of if it was 42 seconds or 69 seconds, how long their hand was crushed? Wouldn't you say that's...
I think I told you this before, but I'm going to say it again. So I worked for R.R. Donnelly. It was a big press room, huge offset presses. And it was normal for people to lose fingers. It was normal for people to lose arms. That was a normal thing. It wasn't like, oh my gosh. So I'm working at Big Dog one day, and this guy was sitting at the bar, and his legs were like sort of under where the overhang was, okay? And the other server was serving him on the other side of the bar, and I was walking in the front door, so I was on his side of the bar. And she calls me over, and I stand right next to him. He's sitting at the bar, I'm standing there. And she goes, yeah, this guy has worked for Donnelly for many, many years. You worked for Donnelly too, didn't you? I said, oh yeah, I worked for Donnelly. And he says... This is not good. This is really not good. He says, do you remember the guy that lost his leg at Donnelly? I said, oh, yeah. Wasn't his name Eileen? And then the other server was like, She started shaking her head. No, 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 no. Thank God he started laughing because he was the guy. I didn't see his legs. He didn't have a right leg. He didn't have a right leg. And I called him Eileen. See, this is why I don't drink and do a live stream because my mouth does not have a filter sometimes.
Fair.
Objection, speculation.
What do I do? Answer.
Just answer the question.
I'm trying to get the specific injury state of mind. Like, is this something where it was truly crushed? Was it, something that was hit against and then it was easily pulled out within 30 seconds? And so, to me, if you're looking at it, to answer your question clearly, which I'm not going to skip over, I don't think that 45 seconds versus 72 seconds matters, but under a minute versus 5 minutes, 4 minutes, I think that matters.
Okay. And if the individual who was driving the forklift at the time, if he testified that he thought it might have been under 5 minutes, his hand wasn't crushed in there, does that mean anything to you?
That's why you have to ask witnesses and try to get what the real time is, because he might be anxious, worried, having his own situation for having injured somebody, so he may not have a good perspective on time either.
Right. But you weren't provided his deposition by the defense, were you?
No.
Okay.
I heard under 5 minutes is long enough.
And you weren't trying to say that she was lying about the time, were you?
No, I think that there's some lack of clarity as far as to how much time there is.
No, you know what I mean. Having a beer or two is not drinking. It's not getting lit on my live stream. I would never do that. Never, never.
But it certainly did not exceed more than a couple of minutes, because from all the documentation that I have, it was not a lengthy amount of time.
Okay.
That I 100% agree with. Absolutely. If you're sitting there and you can see your hand crushed, you're looking at it, you can't get it out. Yeah. But if you're going to get workers' comp claims, don't post all this stuff on social media of you using your hand. Oh no. No. Nope.
Any further questions,
Food is
Doctor?
important.
Thank you. I have a few follow-up questions, Doctor. When our firm sent this case to you, were you asked to come to a predetermined conclusion?
No.
Have you ever had a situation where someone has sent somebody to you for an IME and you've gone back to them and said, hey, I think this person actually has a good claim against you, or this person was really injured by your employee, or whatever the case may be?
Yeah, I have IMEs where I see a patient, I think that they have real issues, and then I would be asked if I would take over their care. And then there's situations where I say, yes, I think that this person needs surgery and I'm happy to do it for them.
Okay. And then again, you weren't asked to come to a predetermined conclusion, correct, in this case?
No.
All right. And if you had looked at Ms. Norris and decided that you believe she was being truthful in her claims, what have you found such?
I'm going to object to that as a leading question, but
Okay.
Typically for an IME, I'm asked if there's additional treatment to be done, or if there's, is there anything else to do? And, I would comment that, they need therapy, or there's scar tissue that needs to be released, or there's something that needs to be done for this case. In this specific case, I don't think that there's an anatomical basis that's in the hand that can fix this. I was in belief that her exam was exaggerated in the office, and seeing the videos on Friday helped to confirm what I was suspecting, that the hands are being used much more so than what she's complaining about.
When somebody complains of numbness or tingling, is that something we would call a subjective complaint?
Yes.
And if Ms. Norris was complaining of numbness and tingling, that would have been a subjective complaint, correct?
Yes, it's subjective, and it's also of different severity. So there can be mild numbness, it tingles every time I wake up, or it could be dense, constant numbness or severe tingling.
Okay. And in Ms. Norris's case, there was no way to confirm by any objective testing you did that whether she had numbness or tingling, was there?
Correct. And just what I try to compare it to the opposite hand, and subjectively said that there's decreased sensation, increased sensitivity on the right injured side.
And you testified on cross-examination and questioning from Mr. Wilson that there could be a positive Waddell sign due to anxiety. Did I catch that correctly?
Waddell signs
Same.
are essentially non-anatomic, so something else that's causing that. I have not seen in my practice that someone is going to try to move their other hand with their opposite hand to show motion when they're anxious. Like, it didn't really correlate with that. Certainly there's cases where there's stage fright or something, where someone's kind of cool, clammy, before a big gig or show or something like that. But
So in case you haven't noticed it, guys, this is a recorded deposition by both lawyers. I guess, I'm pretty sure. They recorded this earlier, and now they're playing it in court to the jury. It's a full jury.
I would not say that the patient and the IME showed any evidence that they were feeling dizzy, lightheaded, or sweaty, or fumbling their words. They seemed to be very comfortable with what they were answering and showing for me.
And that was the case in Ms. Norris's case, is
Yes.
that correct? Okay. I have no further questions.
no questions.
We finished?
The defense rests.
Before you get confused, everybody, yes, this is her courtroom, but she's not there today. It's probably pro tem. I don't know his name. This is Indiana.
Is there any rebuttal evidence?
Just briefly, Your Honor, the plaintiff would be Colleen Morris.
I just
And
wish
as
she
you
would have
retake the witness stand,
rode a horse in. I mean, why didn't she ride a horse in?
consider that you are still under oath.
Yes.
Amy, this is working.
No.
Amy, you watched the video of Dr. Fuller with the rest of us. Did you agree with his description of how the exam went?
No, I did not.
What occurred differently in your eyes than what he described?
Well, when he said that I couldn't lift more than 5 pounds, that's never been a discussion because I can lift more than 5 pounds. The question is how much pain does it cause me when I do so?
Her testimony is great, by the way. She does really well, in my opinion.
Something else he said, in that video, I was handling the wheelbarrow with ease. In the one video, you clearly see I was struggling with it. I never said I can't make a fist. If you'd like, I can show you. He claimed that there was no discoloration in my fingers, which is not true. I can show you that as well. I just didn't like how his whole attitude went in the video.
Thinking back to all right, Amy, thinking back to the video from Dr. Fuller, I believe he testified
Thank you
that
so
your
much,
exam
Another
lasted
Smith.
15 to
Hi,
20
Hedwig.
minutes.
It did not.
How long is your recollection of how long that exam lasted?
I sat in the waiting room for 15 minutes and was in his office a whole whopping 5 minutes.
And there was some discussion, and I can't paraphrase it correctly, I don't think, but where he said he tried to manipulate your hand and you kind of jumped or something. Do you know what he's referring to?
Yes, he held his fingers up like this and told me to wrap my fingers around like this, and he started pulling on my fingers, which is when I jumped. Not lunged at him, but jumped. And when in the video, when he said my arm was trembling, never happened. My arm doesn't tremble.
And did you ever tell him that you can't hold a cell phone?
No,
Now, he mentioned the bale of hay. How much does a bale of hay weigh approximately?
it depends on the baler and how tight the bales are wrapped, but they can weigh anywhere between 50 and 80 pounds for a normal size square bale.
Okay, and then I think he said water buckets, that you had trouble carrying water buckets. Do you know what he's talking about?
Yes, I
And
do.
so what are those?
I do not know how much water weighs. I have no clue. But when I'm trying to carry
I think we're supposed to say a number and liter. That if that helps, lady. It's liters. Like it weighs 18.5 stone liters.
5-gallon bucket full of water and the metal is across my fingers, that's a no-go. That causes too much pain. I can do it with my left hand, or I can carry the bucket empty with my right. I just can't carry it full.
I don't have any further questions.
I have no questions.
Are there any?
Don't the police ride horses where you are? Don't you see horses on the road? I have the Amish. Their horses are always on the road. And then I have the police, and they trot around on their horses too. It is about workers' comp.
Juror questions at this point? Appearing there are no juror questions, ma'am, you may step down.
She said what Lori was thinking, what I was thinking. Even though it hurts, she's still going to do her work. But it still hurts. She's still in pain because she had this injury, but she's still going to do her work. I mean, I'm calling BS, complete BS. But anyway.
Any other rebuttal testimony?
No, Your Honor.
Any sir rebuttal?
No, sir, Your Honor.
Right, at this point, we are going to recess for lunch, and we will recess until 1:45. At that point, we should be ready to proceed with arguments of counsel, and then we'll have final instructions and be able to finish up the case. I need to give you the admonishment I've given you each time. Generally, you are not allowed to express an opinion about the outcome of the case until it is submitted to you for your deliberations. You may discuss the case in the jury room during recesses, provided all jurors and alternates are present and may participate in those discussions. You must reserve your judgment on the outcome of the case until it is formally submitted to you for your deliberations. And I would add to that, the most important piece of that is you're going to receive additional instructions on the law that applies here. And of course, you'll also have the benefit of the final arguments. You may not obtain information about this case from any other source through any means whatsoever. You should not allow yourself to be questioned about the case. You should not allow yourself to be exposed to any discussions about the case. You are to decide this case solely upon what you see and hear in the courtroom and the evidence which has been admitted in this trial. Do not use your cell phones or computers or any other electronic communication devices about this case. Please don't post anything about this case. And with that, when you come back, return to the jury room and you'll be brought back into the courtroom at the appropriate time. Have everyone rise, and the jury is released for lunch.
So, the jury did not come back. He did not play anything. So I'm waiting for the judge to post what happened on this case. He has not posted what happened yet. So we're going to decide right now. I have a poll running. Did she commit fraud or did she not commit fraud? I'm not stopping it right now, Fozzie. No. So tell me what you think in the poll. Oh, wow. I didn't think it would be this many votes for that. Wow. I don't know, Fozzie. I'm wondering the same thing. I thought we all watched the same videos. No, there's no maybe. The judge can't sit there and say, maybe you're innocent, maybe you're guilty. Nope. Judge has to make a decision. What decision is he going to make? Okay, now it's better. The belly flop on the horse alone makes her guilty. Raven, just vote what's in your heart. All right, I'm going to end the poll. Last chance. If you have not seen the belly flop on the horse, you're going to have to. The videos are great. Okay. 26 votes in. 77% of you feel like she should not have been collecting workers' comp. That she would have been fine going back to work. But we will know. I'll let you know as soon as he posts it. I keep checking every day. Now, we're going to move on to one more. And it's the same thing, only the video that we see is top quality content. I mean, really good. But it's 20 minutes long, and it's just that one video that's top quality. I mean, we get to, because so what we just saw was something we don't hardly ever see in court videos. But this next one is domestic violence. We see that all the time. But, at least we got that last one. So, just wait for the video. The video is video is amazing. And this is thinking. Oh, New Jersey. Look, it says right there. We're in Jersey.
Good afternoon. We're going on the record. My name is Judge Jorge Coombs. Today is the 20th of December, 2024. The time is 12:10 p.m. This is the matter of State versus Daniel Shaw. Complaint warrant 2024-744-0506 and W 2024-745-0506. This hearing today is to consider prosecutor's motion for pretrial detention. The matter is being conducted virtually. Counsel, your occurrences, please.
Right, you're on behalf of the state.
Kate Weigel on behalf of Mr. Shaw.
The video that they play in this clip is top quality, and no one can say any different. Wait till you see it. It's really good.
Defense counsel, can we mark this as your client's first appearance?
Yes, Judge. My client's aware of the charges against him as well as his attendant rights. I would ask that the first appearance be marked complete.
And his awareness of his rights includes his appellate rights. Is that correct?
Yes, Judge.
I'll mark the first appearance as complete. Court is satisfied the defendant has been advised of his pretrial and appellate rights. I've received and reviewed the following with regards to this matter. The complaint warrants, both of them, preliminary law enforcement incident report, affidavit of probable cause, public safety assessment with a run date and time of the 13th of December 2024 at 9:08 a.m. and the aforementioned prosecutor's motion for pretrial detention dated the 13th of December 2024. Prosecutor, is there anything else that the state intends to rely upon for today's hearing?
Judge, I'm going to proffer off several documents that have been provided to defense. I am going to play a very short clip that I would ask to be marked as an exhibit. It captures the collision that's at the heart of the matter.
So it's a video clip or an audio clip?
It's a video clip, surveillance.
So video clip and defense, any objection to marking the 3 state exhibits?
No, Judge. Mr. Yor did provide me with a copy of the video. I was able to view that this morning. Thank you.
So I'll mark as S1 the complaint warrant packages, the affidavits of probable cause, the preliminary law enforcement incident report. As S2, I will mark the public safety assessment that I previously noted, dated the 13th of December 2024 with a runtime of 9:08 a.m. And the video clip I'll mark as S3. It's also labeled as exhibit. Does the defense intend to rely on any exhibits today?
No, Judge. Thank you.
Does the defendant challenge probable cause?
Judge, for the limited purposes of this hearing, we'll stipulate to probable cause.
Although the defense stipulates to probable cause in this case, prosecutor, could you please set forth or proffer the facts relied upon by the state with regards to probable cause?
Yes, Judge, this was a domestic violence incident. The victim in this matter called for police assistance after an argument ensued, and this defendant left in a white van before police were even able to get to the Highland Inn motel where this occurred. The defendant came back in that white van, and while victim was in the proximity of her personal vehicle, defendant drove his vehicle into the victim's vehicle, causing her to physically move out of the way. Fortunately, she was not injured, and the vehicle not only had significant damage, but also damaged the Highland Inn motel. So for one warrant, Judge, that does encompass the aggravated assault charges and the criminal mischief charges here. because there were extensive damages in line with the complaints for the Highland Inn Motel, greater than $2,000, for the vehicle, the BB victim, greater than $500. Meanwhile, pursuant to investigation, in that short period where this defendant left the domestic violence incident, he actually went down the street to the Middle Township Police Department's parking lot, and he's on surveillance throwing a beer bottle at one of the vehicles, as well as smashing his white van in another vehicle. So the damages there were assessed at over $500. So that is the other warrant, which was a fourth-degree criminal mischief. For both, I think there's sufficient probable cause.
And do you intend to show your clip at this time?
Judge, I can. I was just going to say that for the argument portion.
The court has heard the representations of the state and will note that probable cause is a relatively low standard. Probable cause is a well-grounded suspicion that a crime has been committed and the defendant has committed that crime. With respect to the issue of probable cause, having reviewed the preliminary law enforcement reports and affidavits of probable cause attached to the complaint warrants, as well as defendant stipulating as to probable cause just for today, the court finds and concludes the state has established probable cause that this defendant is an eligible defendant and he committed the charged offenses. Specifically, there is reason to believe that defendant Daniel Shaw committed the crime of second-degree NJS 2C:12-1B1 aggravated assault, attempt to cause serious bodily injury. Fourth-degree NJS 2C:12-1B3 aggravated assault, cause injury with a weapon recklessly. Third-degree NJS 2C:17-3A subpart 1 criminal mischief, damage to property more than $2,000. Fourth-degree NJS 2C:17-3A1.
That would be awesome, but he would get in a lot of trouble if he commented on any cases or other judges.
Criminal mischief, damage to property between $500 and $2,000. Fourth degree NJS 2C:17-3A1 criminal mischief, damage to property $500 or less. And disorderly persons offense 2C:17-3A1 criminal mischief, damage to property of $500 or less. The alleged charges stem from conduct which allegedly occurred on the 12th of December 2024. On that date, at approximately 12:41 hours, officers were dispatched to 38 East Mechanic Street, the Highland Motor Inn, located in Cape May Courthouse section of Middle Township. There had been a 911 report of a domestic violence incident. Once they arrived, the victim, the alleged victim in this case, advised that the defendant had thrown a gallon of milk on her vehicle and fled the area. Again, there was also a report by the victim that the defendant was intoxicated and may be armed with a knife. Again, once officers
Teddy Grahams
were finally able to interact with the defendant, they gave him verbal commands. He appeared to be non-compliant and refused to answer officers' demands. After being handcuffed, police spoke to the alleged victim near her vehicle, which was damaged, and officers noting that it had been involved in an accident. Again, officers noted that the allegation was that the accused threw multiple items.
Thank you, Anthony. Thank you.
Including the gallon of milk out of the party's residence and onto her vehicle prior to leaving the area. And that the accusation is that the defendant returned to the scene, at which time he allegedly drove his vehicle into victim's vehicle, causing both damage to the vehicle and to the Highland Motor Inn building. Victim informed officers that she was in close proximity to her vehicle at the time of the alleged crash and feared for her safety. Court, based upon those facts and circumstances as alleged, finds that probable cause is found for the charges to issue. With regard to detention, the court reviewing the public safety assessment notes that the PSA has a score of 3 for failure to appear and 3 for new criminal activity. PSA recommends no release recommended and includes a new violent criminal activity flag due to an elevated risk of violence. I'll now hear from the state on the issue of detention.
Judge, it's the state's position that there is no conditions that adequately assure that this defendant does not pose a danger to the protection and safety of the community as well as this victim.
Snacks. Snacks are great. Thank you, Fletcher. Thank you.
I think the sequence of events here is important. And the restraining order facts that have been provided to the defense, I think also are illustrative of what really was happening behind the scenes here. The victim here, the defendant here, according to the victim, has issues with alcohol. And the argument really stemmed from the defendant wanted to use the victim's car to go buy more alcohol, but she wouldn't let him because he was drinking. So he took his car, which the victim knew was unregistered. Argument ensues.
Pay attention, people. Here it comes. Okay?
Starts to accuse the victim of cheating, starts to throw some things at the victim's car. So she calls the police. And he was almost antagonizing in the sense of asking her to call the police, and then he leaves. So you would think that that's where it ended, but he comes back. Before the police got there, comes back in his van, and this is what occurred next. It's surveillance clip. You can see a white van ramming the victim's vehicle. The victim is nearby, causing extensive damage. Before this even occurred, according to the victim, this defendant pointed in her direction, so this was not accidental. I don't think it looks accidental. And he did ultimately admit to the officer that he was driving the vehicle. Officers were on scene to see the damage. So I'm going to share my screen right now.
Here we go.
Here's the clip. Can you see that screen of the white van there, Judge?
Yes, I can.
I'm going to hit play right now.
So we drove past her almost. She's right there. That's her. Or she's near. Come on.
Thankfully, police.
We've all wanted to do that. All of us have wanted to do that. He drives past her. But wait, there's more.
Thankfully, police did show up shortly after.
There's no more video. There's no more video of what he does next. But what he decides to do next is epic.
Afterwards, according to the victim, the defendant did get out of the car. She actually went into the Highland Inn motel and locked herself in there because she was fearful. The intent seems clear there. He backs up the vehicle. He goes in that direction. Thankfully, no one got hurt. But we're dealing with someone who obviously has threatened the victim here. According to the victim's TRO, she does note there had been previous incidences unreported where he would hold a knife to her as well as slap her. There was accusations of cheating at the time as well. All of this alone, Judge, I think is enough to show by clear and convincing evidence that there's really no assurances and a piece of paper that says don't drink or stay away from the victim. This is very escalated violent behavior. And looking at the criminal history, there has been violence in the past. There's a DP and an aggravated assault, although dated, still exists. And there is a restraining order history. So there is some groundwork here. Someone who might have issues aside from alcoholism does pose a danger to who he shares a relationship with, especially after watching that video. You can see there was an indifference I would say, to the safety of that victim. But on top of it, Judge, I haven't even got to the other part, which I think indicates a danger to the community. And that is from the period that he left, from she first called, he goes down the street to the Middle Township Police Department, which is about a mile away, if that. And he is clearly on surveillance in the white car, getting out of that car, throwing a beer bottle at a police officer's car, getting back in, and then smashing his van into one of the police officers' van. So by the grace of God, no one got injured during this whole drive from the Highland Hotel to the police department back to the Highland Hotel. But everyone on that street was in danger during that whole time. Given the intoxication issues that seem to be present here, given the seriousness of the charges, second degree is the highest, punishable by 5 to 10 years. There is really no failure to appear history, Judge. I'm not really harping on that. The obstruction portion, I'm not really harping on that. What is of, I think, primary importance here and what justifies detention in this matter, which is the recommendation of the PSA, is that this victim was in very serious harm's way and the community was in a very serious harm's way. And for the protection of both, I think this defendant should be detained pending the resolution of his very serious charges.
Defense?
Your Honor, I am going to ask that you deviate from the public safety assessment and allow my client to be released with reporting conditions. Recognizing that the recommendation is no release, I would argue that level 3 is appropriate in this case to ensure the safety of the community, the safety of the complaining witness / victims, and most importantly, that my client comes to court when he is supposed to. I would note that he does have a mailing address in Vineland, New Jersey. For about 4 to 5 months, he was residing at the Highland Motor Inn.
We're in New Jersey. So in New Jersey, there are no bonds. There's no bail. They either detain you or they let you out and you have conditions. So you have level 3 monitoring, level 2 monitoring, level 1 monitoring. But no one has to post a bail in New Jersey unless you're already unless you had a bail before the laws changed and you're still under that bond, that bail, then you can lose bail. But yeah, there's no monetary bail or bond in Jersey right now.
And before this incident, he recognizes that he's not going back there, Judge. He will need a little bit of time to get things in order to establish what residency he will be able to obtain, but he could make that known to pretrial services upon getting something in place. And again, he does have a good mailing address in Vineland, New Jersey. He's currently unemployed. His last set of income was approximately 2 months ago. He was working at the ShopRite in Rio Grande. Unfortunately, my client has a very significant medical issues which have stopped him from working.
Alcoholism.
He has what's called a hydrocele. It's a swollen testicle surgery that was scheduled. Unfortunately, now the date has passed. He was scheduled for this surgery while he was in custody pending this detention hearing at the local hospital here. But so he's in a significant amount of pain. Judge has a very sensitive medical situation unfolding. And so I would argue to Your Honor that he's not somebody who's going to flee the jurisdiction. He's under a doctor's care. He'll be reaching out to the hospital to try and get his surgery reestablished so that he can, kind of begin to heal from that. But even that is going to take a number of months to heal from, Judge. And so he'll be working with doctors, working with appointments. He's not going to be fleeing the jurisdiction. I would argue that he is not a flight risk. My client's criminal history on PSA is very limited. While there do show 2 prior violent convictions, the most recent is 2008 with a 2010 disposition date. The other was also 2008 with a 2009 disposition date. So this is a very out of character situation, Judge, for my client. He's been law abiding for well over a decade, has a situation that unfolds potentially, Judge, with the accusations and allegations that alcohol was involved, a task evaluation and following by those recommendations would be a restriction that would make sense for the situation to ensure not only that my client comes to court and is reliable with pretrial services, but that the safety of the community and the complaining witness in particular are helped so that if there is any treatment that my client needs to pursue
Jen, I know that's why I don't run.
regarding his alcohol use, he can begin that journey as soon as possible. With all those items put on the record, Your Honor, I am again going to ask that you allow my client to be released. Thank you.
Anything else from the state?
No, Judge, thank you.
Court has
We're not going to go into politics here at all. We're not there yet, but we're getting closer and closer. And so I'm just telling you, we are not going into politics here. It creates enemies.
reviewed the prosecutor's motion for pretrial detention regarding State versus Shaw. Once again, this is on complaint warrant 2024-744 and 745-0506. In reviewing the exhibits, which included S1, 2, and 3, S2 being the public safety assessment, S3 being the video clip shown by the state.
The excellent video
The
clip.
court finds as follows. Defendant is 52 years old. He is not currently on pretrial monitoring. PSA gave a score of 3 for failure to appear and 3 for new criminal activity. PSA recommending no release recommended due to new violent criminal activity flag. Court reviewed the underlying charges, facts, and circumstances of this case, along with defendant's criminal history and the arguments of counsel under the triad. First, under the first prong, failure to appear, the court finds that defendant, although he has no prior failure to appear in the last 2 years, he does have a prior failure to appear older than 2 years. Additionally, the court is concerned that he lives out of county or maintains an address out of county, and the allegations are that he had fled from the scene of the incident involved in the instant matter. Additionally, the court finds that compound with concerns for substance abuse involving the defendant place him at a high risk for failing to appear at a future court hearing. Under the second prong of the triad, safety of the victim and the community at large, the court is also quite concerned with regard to not only the safety of the alleged victim in this matter, who is a person known to the defendant. It is marked as a domestic violence incident, but that in reviewing the defendant's prior record, he has 2 prior violent convictions in the past. I will note, as defense counsel did, that they are from 2008, so not necessarily close in time. However, they were also violent charges and domestic violence related. Additionally, the court has a concern for the community at large as well as law enforcement, as the allegation is that in fleeing from the scene that the defendant caused damage to not only the Highland Motor Inn, but also to victim's vehicle, police vehicle, by not only throwing things, but smashing, allegedly, his van into a police vehicle. And the court finds that there is a concern for the safety of not only the victim, but the community at large. With regards to the third prong of the triad, obstruction of justice,
Pennsylvania is too close to Jersey for me to not be concerned about this guy.
Again, there's an indication, again, from the allegations and the representations made by the state in this case, that not only in attempting to flee, but also in specifically targeting law enforcement, that there is a concern that the defendant in this case may wish to obstruct the criminal justice process. Additionally, the court will note that defendant at the time of the alleged offense had 0 pending charges. In addition, defendant has 1 prior disorderly persons conviction for NJS 2C:12-1A subpart 1 simple assault causing bodily injury. Defendant has 1 prior indictable conviction for 3rd degree NJS 2C:12-1B2 aggravated assault attempting to cause bodily injury with a deadly weapon purposely or knowingly. Defendant has 2 prior violent convictions, again, disorderly persons, simple assault, and 3rd degree aggravated assault with deadly weapon, purposely or knowingly. Again, although those prior convictions are dated, as I indicated, back to 2008, and defendant is not on probation or pretrial monitoring, it does show a tendency that defendant appears to have. Defendant does have 2 domestic violence related active final restraining orders for assault, harassment, criminal mischief, terroristic threats, and other crime involving risk of death or injury. Those active final restraining orders were issued in 2009 and 2024. Again, he does not have any active warrants or detainers. Again, reviewing the PSA, score of 3 for failure to appear, 3 for new criminal activity, and recommendation of no release recommended due to the new violent criminal activity flag. The court gives great weight to the recommendation contained on the PSA. The court appreciates the severity of the charges and understands that the current alleged charges are particularly violent in nature, as they involve not only domestic violence victim, allegedly, but also damage to a structure that is open to the public at large, as well as to police officers and police equipment.
Todd, look at you all in Texas. I hear that you have to go to Bucci's. You have to go to Bucci's. When you go to Bucci's, actually, someone came into my bar like 2 days ago and has no idea about my channel or anything with Texas, and showed me in Pennsylvania, where we don't have Bucci's, showed me a onesie that he just bought of a Bucci onesie. I don't know. It has like a tail. It's a onesie. It's a whole onesie, and he has no idea about me. He has no idea that I know some folks in Texas. You know, he was just showing me that he bought this onesie, and it turned out to be a Bucci onesie. So you should go and check it out and buy a Bucci onesie.
Court also places weight on the existence of the prior history of violence, and particularly domestic violence related violence, and concerns for defendants' alleged substance abuse.
Bucky's?
Based upon the totality of the circumstances, including defendant's criminal history, the recommendation of the PSA, the facts of the case, the court finds that the state has established that no amount of monetary bail, non-monetary bail conditions, a pretrial release, or a combination of monetary bail and conditions would reasonably assure defendant's appearance in court when required. Again, I do find him to be a flight risk and does not live in county. Protections of the safety of any other person or the community, and the defendant would not obstruct or attempt to obstruct the criminal justice process. Again, the court being concerned for his attempt to throw a beer bottle at police and crashing a vehicle into a police vehicle. For those reasons, the court finds the state has met its burden by clear and convincing evidence based upon documents presented to the court, including the recommendations of the PSA. Therefore, detention is ordered. Sir, you have 7 days to appeal the court's decision. You should be afforded reasonable opportunity for private consultation with your attorney prior to your next court date. That court date will be on the 11th of February, 2025. And that's Team B. Is that Judge Gibson?
Yes,
Yes, Judge.
So that'll be before Judge Gibson. Anything else from the parties at this time?
No, Judge, thank you.
Nothing from the defense. Thank you.
With that, we're off the record at 12:36 p.m.
Sir, you can leave the booth.
You can leave the booth. Actually, you can all leave the booth. Overwhelming? Nah. All right, guys. We did it. We made it through. No, there's no OJ today because I have to be at work in 2 hours. I don't want to go to work. You know what? Usually we're closed every single Monday. And this Monday and the Monday before New Year's, they decided to open and close on Tuesday. But they didn't ask any of us. They didn't even tell any of us that they were going to do it. We just found out because there were signs on the door that says, hey, we're open Monday. And now I'm on the schedule. They didn't even ask me. They just assumed that I would go to work tomorrow. And I mean, they're right. I'm going to, but they could have asked me first, right? Oh, no. I don't need pockets at work because I have my big 3-pocket apron. So, oh no, I never call in sick. I never call in for flat tire. I never call in. I don't. I work when I work. I work when I'm scheduled every single day. First, it won't be a truck. First, it'll be a kitchen that'll do online deliveries late at night after all the other restaurants in Lancaster close, right? And as soon as I passed my test and I started planning my menu, everything changed. It's no longer Vibes online delivery. Now it is Insomniac Munchies, Home of the Girl Dinner. Hold on. This is what it's going to be. Home of the Girl Dinner is everything on the menu is $3 for the girl dinner, just for the girl dinner, okay? So, a waffle or spaghetti or rice or soup or a slider, $3, okay? All right? But you only get about the size of a slider. So the cup is like this big. So, a girl, she doesn't want a full plate of spaghetti, but she wants spaghetti. She doesn't want a whole thing of French fries, but she wants French fries. She does not want a whole big thing that she's never going to eat. She just wants a little bit of everything. That's why when you ask women where do they want to go to eat, they can't answer you because, yes, they want McDonald's for their fries, but they don't want a whole meal from McDonald's. They really want some pasta from the diner because it's really good, but they want the fries too. And they want the brownies from the other place. So what I have is girl dinner. Everything is $3, and you can pick what you want. Just little tiny little portions. A little slider, little fries, little this, little that. And then we also have, a full size if the guys want something. But yeah, Insomniac Munchies, Home of the Girl Dinner. Hi, I hunt you. And that's what I'm going to be doing. They can eat off their own plate. Just a little bit. Yep, the equivalent. Yep. That's right. And you can. You absolutely can. See? And you can order a girl dinner. It's delicious and you get to taste all of it. Oh. Hell no. My makeup does not last a full stream, and I don't know why, but it doesn't matter. So I love at the end when I'm way down in the corner. No, Donald, no. Absolutely not. Anyway, thanks for coming out. No OJ today, but I will see you all in 24 hours. Thanks, guys. I appreciate it. Bye.
Got these life echoes, digital dreams through the right. Even when my world turns gray, with a giggle, she lights the way. Kathy's laugh cuts through the gloom, eyes blue like a summer's bloom. Her humor dark and twisted, sharp. In a way, there's no